Hi, this is Lucy. Lucy is European. She comes from an ordinary family. Lucy takes care of herself. She doesn't smoke, eats quite healthily, and takes regular exercise. In fact, Lucy has a pretty average life. She could be any of us. But guess what? Lucy will have at least 2 chronic conditions in a few years, and these conditions might stop her from working. That means she will need to access the healthcare system and the social care system when she is on sick leave. She might even need to take long-term sick leave or retire from the workforce. Lucy's story is not unique. 1/3 of the EU population will be over 60 years old in 2050. The cost to the EU each year in loss of productivity and sick leave absence is 240 billion euros, 2% of GDP. 86% of deaths are due to chronic diseases. How can we support Lucy to stay healthy? What can we do to help her live a longer, healthier life, enjoy her work and her family? Aging demographics, limited public health resources, slow economic growth, health inequalities, poor health literacy, fewer healthcare specialists, constraints on physician-patient consulting time. Healthcare systems designed for acute care, not chronic care. The list goes on and on. So where to start? Of course, the simplest way is to start before Lucy becomes ill. Start with prevention. However, today only 3% of healthcare budgets are spent on prevention. That's not all. Lucy needs to know that she can be in charge of her own health. If we provide appropriate information on healthy living, disease prevention, early intervention procedures, and disease management steps, we can help Lucy to establish a healthy living pattern and manage her medical conditions. And one more thing. We need to place Lucy at the heart of the healthcare system and base care on her needs. This will require the redesign and restructuring of care delivery. All of this is a big task, but the man who moves a mountain begins by carrying away small stones. So let us begin with small and tangible actions. Citizens, health professionals, governments, policymakers and advisors, social insurers, academics and industries must work together to transform our healthcare systems towards more sustainability. What we need is a roadmap for sustainable healthcare. We must act together now before it is too late. Do it for Lucy. Do it for you.